A very good morning this pleasant Saturday in Chennai and a sunny noon perhaps in China. My name is Ramya Kannan. I'm the health editor and Tamil Nadu bureau head of the Hindu. I welcome you to a webinar session today that will bust myths and lead us to the truth. Today, we discuss a topic that has unexpectedly and I'd say undeservedly occupied public consciousness since the new year. As 2024 eased into the new year, we welcome 2025 with an infodemic. If you were to believe media reports, a dangerous and mysterious virus had once again sent hundreds, even thousands of people in China lining outside hospitals. TV screens showed us images of people crowding in hospital like places, portending that this would be the next pandemic for the world. It seems that after the experience of the COVID-19 pandemic, the world has become extra sensitive to even the sniffles and coughs emanating out of China. However, we say once bitten, twice shy. Has that really happened? Not really. Despite our experience of the pandemic, we still aren't on guard against fake news and infodemics, which is what we are here to clarify today. I'm happy to tell you that this webinar is part of the Healthy India, Happy India, a joint initiative of the Hindu and Narvi Hospitals Fellow to build awareness on preventive healthcare and promote wellness. The campaign began early December and it was inaugurated by the Deputy Chief Minister of Tamil Nadu, Mr. Udayanidhi Stalin. Cutting to the chase. Today we have experts preeminently qualified to sift the chaff from the wheat and present the truth of the Human Metapneumovirus, or HMPV as it is now come to be called, a virus that is neither unknown nor mysterious, and in fact for 2 decades we have known that it causes symptoms akin to the common cold. We are thankful today, extremely thankful to Dr. Soumya Swaminathan and Dr. Bernhard Schwartländer, who is currently based in China, for having spared their precious time at fairly short notice. We are eager to hear from you. Let me tell you that this seminar is open for all and subscribers can ask the questions. Links are available on whichever platform you are on. Please use that to send in your questions. We will start today with Dr. Soumya, who needs no introduction to us. You're all very familiar with her. She was a chief scientist at the WHO during the crucial years of the pandemic between 2019 and 2022 and is currently the chairperson of the MS Swaminathan Research Foundation in Chennai. She has been the single most powerful voice of science, bringing us back to the path of rational medicine during and post-pandemic. Welcome, Dr. Soumya. The floor is all yours.
Thank you very much, Ramya, and a very good morning or good afternoon to listeners. First of all, thank you for launching this series of webinars, because I think it's really important to create both more health awareness and health literacy in the population, but also scientific literacy and more scientific awareness, so that we don't see the kind of panic that we saw happening a few days ago in India, particularly when news of this HMPV virus actually came out. So, I think that the COVID pandemic has sensitized everyone, the general public, to the threat of viruses. And unfortunately, we do live in an era where it is becoming more likely that we will have both known as well as emerging viruses, new viruses that may be infecting other species in this world, but which make a jump to humans and then are able to infect from one human to another. And that's how outbreaks of new viruses begin among human beings. We already have a large number of viral families that infect humans and that are either very common or very rare. For example, just the family of coronaviruses alone, there are thousands of coronaviruses Bats are the most well-known carriers of these coronaviruses. And so far, the human race has seen 3 coronaviruses that have infected us: the SARS-1, that outbreak that luckily got contained in 2003-4. Then we have the MERS virus, the Middle East Respiratory Syndrome virus, that the host is the dromedary camel. So it's very common in the Middle East, and it causes quite severe pneumonia with high fatality rate. It's still going on. So it's not like a pandemic. It hasn't spread throughout the world, but it kills people every year. And then, of course, the SARS-CoV-2 virus, which emerged at the end of 2019, we think in Wuhan, and then spread throughout the world and became a pandemic. The world has known about influenza viruses, which have been the cause of all the major pandemics, actually, before the SARS-CoV-2 pandemic. Each of the pandemics, starting from the very well-known 1918-19 influenza pandemic, where millions of people died, and then several smaller ones after that, they've all been influenza. And so there's been a lot of attention on influenza viruses. And in fact, the WHO's global influenza surveillance program is about 50 years old, and it has, over 130 labs from around the world as part of this network. This network is actually a very good model for international collaboration on both surveillance and research into influenza viruses. There's regular reporting, and one of the things that come out of this reporting is the fact that every year the influenza vaccines are updated. There's a northern hemisphere vaccine and a southern hemisphere vaccine. And because the virus changes and mutates every year, there are some new strains that are circulating. So scientists pick the most common strains that should go into the vaccine every year. So it's also a very useful activity, results in a product that people use. And therefore, it's also supported by private sector, by the industry. They actually pay a certain amount of money to this network, through the WHO, to this influenza network, and this then sustains these activities. So when COVID started, in fact, this network was the first one actually that jumped into action. WHO reached out to all the member labs and said, look, we've got this new respiratory virus. Here's the testing algorithm. Can you all start testing for this SARS-CoV-2 in addition to what you do for influenza? And we were able to, from there, of course, building on that, then testing became more and more prevalent as time went on and more diagnostic kits were developed. Now, we therefore must be prepared in the future to live with viruses, both known ones, but also be prepared for the new ones. And the difference, of course, is that when there's a new virus that emerges for the first time infecting human beings, we have no immunity. And therefore, we're all very susceptible. And some of us, and depending on the virus, depending on our state of immunity, depending on how that virus spreads, whether it's through air or whether it's a bloodborne or a vector-borne disease, the impact on humans could be different. But let's say a respiratory virus, which is the one that, actually has the potential to spread most rapidly and most widely, the impact on human beings will depend on these factors, on whether we have pre-existing immunity or not, how virulent the virus itself is, and then what measures we take to protect ourselves. And based on that, the pandemic will unfold. We learned so much during the COVID pandemic. We therefore know a lot more about transmission, for example, and also on how to protect ourselves. The other side, of course, is what we call countermeasures. That's diagnostics, vaccines, and therapeutics. And this is where the miracle of science and technology plays out. Because again, for the first time during COVID, we could see such rapid development of these countermeasures. Of course, we didn't do as well on drugs. I must say that the world as a whole has not done well with antiviral drug development. We've done much better with vaccines. There's so many platforms now, so many groups that worked on vaccines. Governments put lots of money in, philanthropic organizations put money in, private sector also put a lot of funding into this research and development at scale of vaccines against SARS-CoV-2. Similarly, diagnostics, we went from having like one lab per country that was able to do these PCRs, to rapid tests, self-tests, which you can now do at home. And within a couple of minutes, you know whether you have the infection or not. So I think that kind of demonstration of the power of science and technology is now going to be very important for us as we think about future outbreaks, epidemics, or pandemics. And the WHO actually does have now a new blueprint of priority pathogens of about 28 families of viruses and one bacterial family that can cause severe infections in humans potentially, and that we should be prepared for. And they also now have a network called the Collaborating Centers for Research in these viral families. It's called the COC network, and India is part of that. And it's basically to prepare ourselves for surveillance, but also for R&D, so that we can develop prototype vaccines. We don't know what the next outbreak is going to be. We can guess, we can have some good guesses. For example, influenza is still the most likely to cause the next pandemic. It could be something else. And so if we're prepared, let's say with an mRNA platform or any other platform, to be able to quickly identify the virus, its genetic sequence, and be able to develop a vaccine, if all of that groundwork has been done, then it should be possible to develop a vaccine in even less than 1 year. We took 1 year to develop the SARS-CoV-2 vaccine, but we could do it in less time, potentially. Of course, the clinical trials and all have to be factored in. So I think there's a lot of that kind of preparatory work to be done. And maybe I can talk a little bit later about the plans in India. The Niti Aayog put together a small committee of which I was part to develop a report on pandemic preparedness for India. Many countries have done that. And obviously WHO still continues to take the lead, not only in the normative function, but also in helping countries to come together and negotiate a pandemic treaty that will allow countries to work together. Because what you need also is solidarity, you need collaboration, you need certain rules to be set in advance of a pandemic on how countries will behave in terms of trade, in terms of international borders, in terms of travel, in terms of sharing of technologies, sharing of essential items. Some of those things we did not do well during the COVID pandemic, and we must do better next time. So maybe I'll just stop there for now.
Thank you so much, Dr. Soumya, that, as usual, laid us the perfect ground for further discussions and questions also. Now we go on to our other panelist, Dr. Bernhard Schwartländer, and that's my closest German, as close to German as I can get. He comes to us today from Beijing, China, where he is the Global Health Envoy of the German Ministry of Foreign Affairs. He has worked previously as Assistant Director General and Chef de Cabinet at the WHO, as well as the WHO representative in China. He's a medical doctor, holds a doctorate in medical epidemiology, and prior to these assignments, he has also held several international positions at UNAIDS, GFATM, World Bank, National AIDS Program in Germany, the Robert Koch Institute in Berlin, and the German Centers for Disease Control. He has published widely in scientific journals and books and taught applied epidemiology and health diplomacy. Welcome, Dr. Schwartländer. So happy to have you here. I wonder if you could clarify, since you are on the ground in China, to our audience, how does it actually look? Because we've seen these visuals of people. I don't know whether they're old, whether they're, there's old footage of people just rushing into hospitals in China without any clarification about whether these visuals are old or new. How is the situation exactly in China today?
Yeah, thank you very much, Ramya, for having me today. As you said, it's a wonderful sunny Saturday lunchtime. And of course, it's a great pleasure to be on stage in this discussion together with my good friend Soumya, who is such an outstanding science leader. So I'm happy to follow her lead and also try to put some, how should I say, some common perceptions, the way I perceive them in China, which seem to be quite similar to some of the things that you may have observed in terms of discussions also in India. That's very interesting, I find. First of all, I think I would like to follow what Soumya said. It's to start with that, there's no indication from the data we see that there would be something really out of the extraordinary. But what has happened is, and I think that really has changed since COVID, is that people, they're not only, every year there's an increase in respiratory infections in the Northern Hemisphere in the winter. We see this, we know that, but before COVID, what people said, okay, I got the flu, there's an increase in flu cases. And what they meant, of course, with that is all kind of respiratory infections with flu-kind symptoms, but nobody ever really thought about what's the virus behind. And I think that has changed, of course, dramatically with COVID being so prominent. And we actually did speak about a specific virus. We didn't speak about a flu-type infection. We spoke about a specific virus. And whenever now the viruses are published that may cause or be the underlying source of such an infection that people observe, people get nervous, especially if it's not called the flu or something that I've heard before. And I think there's something completely new coming up. But that probably is simply because they have never heard about the names of these diseases before, but that doesn't mean, of course, that they're new. But they're nervous because that is what happened with COVID. And of course, I think that's very understandable. The second point I want to make, and that's certainly true for China, I don't know India quite as well, but it's the health-seeking behavior of people. China has had a dramatic development in the health system, much improved compared over the last 20 years that I'm actually observing it very carefully, also personally, because I've been working, it's now the third time that I work in China. But the big gap is a solid primary care system. That has many reasons that we won't discuss today, but what that leads to is that people who actually have a disease, who have flu-like symptoms, they tend to rush very quickly into the hospitals, which then, of course, the places where they can actually enter the hospitals and where they get the first sort of investigations may be crowded or may look crowded fairly quickly. So that's, to a large extent, a consequence of the health-seeking behavior, especially when children get sick. The parents are very concerned. You've heard about the very small family sizes in China, which makes it even more prominent that if your child is sick, you rush to the hospital. So very quickly you can get situations, days where you have many people in a hospital room where they wait for seeing a doctor and being taken care of. Now, that certainly may have happened in places here in China. There's no doubt, I have no question. I've spoken to many doctors myself and friends. They say that they haven't seen a massive sort of swamping of their places. I can't judge whether the data or the pictures that we have seen are new or old. As I said, I have no doubt that you can find such places also today here in China. But what we have to do, we have to look at the science. And I think that's what Soumya also said. Let's not be driven by the anxieties that I mentioned initially, because there may be something new. We have to communicate better, but we also have to look into the data that are available in China. Now, China has a very strong surveillance system. I mean, detection of viruses, detection of other bugs is one of the strengths here in China. They have excellent diagnostic capabilities, and not least through what happened with COVID, they have strengthened what they call a sentinel surveillance system that has throughout the countries. They have many clinics and places where they regularly, routinely actually collect specimens of people with respiratory infections and analyze them very carefully, and therefore have a fairly good picture of what's going on. So what they see so far is that, yes, there is, as to be expected, an increase in respiratory infections, which up to now actually is somewhat lower than compared to the same time in previous years, but it's roughly the same. The second thing they see is that the distribution of the viruses is also not so dissimilar to previous outbreaks, with influenza virus being clearly in the lead, but then there's a whole, swarm of other viruses that are coming behind, and that's the same in all countries. And the World Health Organization had a number of intensive working sessions with the Chinese, have analyzed it. They have published a statement on the web just a few days ago, where they summarize very nicely, for those who are interested in more sort of the scientific analysis. We've summarized very nicely where we stand, and at least at the current stage. Now, as Soumya said, things can change, and we need to be on alert, but that's exactly where such surveillance systems can be very helpful. Let me maybe finish on just two very short thoughts. One, I think as much as the science has increased, we haven't been equally well in developing new ways of communicating more proactively what's happening. I think it's no good to just wait for the public to be concerned, for the information zooming around on the social media, where it's very difficult to then actually overcome this. So we have to be, as public health workers, we have to be much more proactive to reach out to people to explain what's going on. So the only information, on the right information, to put it out. So it's not good enough to have a scientific sort of statement somewhere hidden on the website of the National CDC, because that's not where people look every day. I think that's something we have to learn about. We have to learn to do much better to avoid such situations and such concerns. The second thing, and I think that's also at the core of a lot of the work that's going on now, is we have to connect practitioners, scientists across borders much more closely, and make sure that the information between the experts flows very quickly and flows much more easily than it has done in the past. The World Health Organization has established a hub for pandemic preparedness in Berlin, and I had the great honor and pleasure to be part of launching it when I was still working for the World Health Organization. But the whole idea behind this hub is to actually connect centers around the world in ways that haven't happened in the past. We call it the crowd intelligence, to make sure that those who are on the ground, who see the patients, who are in the labs, who see the viruses, can communicate with each other very quickly and form a common approach, a common communication, which is much more powerful than having everybody say something and then, as I said, the communication are not so good. So I think these are the things where we have to catch up. The way Soumya has also said, I mean, she has certainly highlighted the key points in science, the vaccines, the therapeutics, but the communication, I think, is a new science in the sense that we also have to bring up much more to the forefront to make sure that people understand what's going on and understand what we are saying. Right? It's not good enough to have scientists to talk to scientists. We have to talk to people in a way that they understand us.
Thank you so much. Thank you so much for that. That is exactly the point we're also trying to make. We're trying to make scientists speak to the people, and this is one of the endeavors as part of that initiative. Also, thank you for bringing up the social media angle. I think very valuable and very, very pertinent in these days. So with this background, we would like our subscribers to ask your questions. We will then pick them up for our experts. And I think as moderator, perhaps, I will misuse my position to ask the first question. Dr. Soumya, so you mentioned the point about, being prepared for everything, and also the interconnectedness of animal health and plant health. And so that brings us to One Health, which is, which recognizes the fact that we live in a very interconnected world, and environmental health is interlinked with animal health and human health, and the importance of that. Do you think that clearly this is the future, but do you think sufficient importance is being given to One Health? Will this help us prepare for things like HMPV or whatever comes tomorrow in the future?
No, absolutely. I think we have no choice but to take a One Health approach, because clearly, I think what's happening in the animal kingdom, whether it's wild animals or domesticated animals or farmed wild animals or trafficked animals, all of this is actually increasing the risks and the chances of viruses and pathogens actually jumping from one species to another. And we're seeing H5N1, which was traditionally in poultry, now that has infected many cattle farms across the United infections in humans. Now, this actually tells us that more regular surveillance of infections in domestic and wild animals, as well as a system where these are not happening in silos, but really the departments are sharing information, with each other and taking action together. So if you see an outbreak amongst people, usually there's an epidemiologist who goes out and who does the outbreak investigation and tries to determine what's going on and whether it's something simple, and then decide also what action should be taken if it's a waterborne infection or whether it's, a vector-borne infection, or it could be something new. And then you put in place a series of steps, which include testing, it might include isolation, and so on. But the same thing needs to happen whenever there is a warning sign, like if a number of birds are dying in some place or poultry are getting sick, then but this is not usual, not routine, and certainly for wild animals, this is not happening in a routine way. And even if where it is happening, this data is actually sitting with different groups of people. It's not being shared. Similarly, environmental risks today are increasing. Whether this is pollution, air pollution is one of the biggest threats to health today. There's all kinds of heavy metal contamination now in our water, in the soil, and then that finds its way into our food system. There is, of course, microbial contamination. So food safety is again another important issue, because if you have unhealthy animals and those animals come into the food chain, then human beings are going to be eating those animals. So this could be infections, it could be other kinds of contamination. And of course, we also now have plastics and microplastics, which is a most recent environmental threat and which is also very pervasive. And what we're learning about that is also very concerning in terms of the impact on our own health. And therefore, I think this whole concept of One Health, which is that the human species is one species living on this planet. There are many other species, both plants and animals on land and in the water. And we're all interconnected in some way. And we've seen many examples of when one thing is displaced or dies out, it has a cascading impact on many things, sometimes unpredictable. And now with, of course, global warming and climate change, that is also putting pressure on our natural systems. And so I think this is the right time. In fact, it's already too late, but certainly at this point of time, we really need to go back to understanding these interconnections between different species and us, and why our own survival depends on the survival of all of these, and many of the things that we've done obviously have contributed. This is why we say we are living in the Anthropocene, because it is human beings who've created this age. So large farms, for example, cattle farms, poultry farms, where animals are kept very, very close together, where they're cramped quarters, where they're overfed, where they're given antibiotics in their feed only because, we want bigger, fatter animals that can be then sold at a high rate, for meat consumption. And unfortunately, this is leading to deforestation in places like the Amazon, but it's also leading to the spread of antibiotic resistance. So we need to go back and look at some of the ways in which we live our lives, the way we use our land, the forests, the rivers, the water around us. That's the only way, I think, for us, to be able to live healthily in the future. So I think the One Health approach really it is a very broad concept. So sometimes it could be a little bit confusing, but there are many different elements under that. But the concept really is that, that human beings are one more species, and that if other species are impacted, it won't be long before we are as well.
Right, so a lot of lessons in this for the governments across the world as well. Um, we have a question from Ankush Agarwal. Are there any long-term complications associated with the HMPV infection? Dr. Soumya and then Dr. Bernhard, please.
So, as far as I'm aware, there hasn't been a very good description of any kind of major long-term complications. But many viruses can cause what's called the post-viral myalgia syndrome, and it's still an ill-understood syndrome. We've seen with long COVID, of course, many people who had COVID, especially severe COVID, did end up with symptoms that lasted for a very long time and took months or even years, to recover. And we also know that the SARS-CoV-2 virus was not just a simple respiratory virus, but had impacts on many organ systems, including the brain and the cardiovascular system. So I don't think things like that have been described with the HMPV. But then I don't think we've had those kind of systematic studies either, because it's been considered as a rather mild infection that causes upper respiratory illnesses. People get immunity as they're exposed in childhood. And so it hasn't been a major cause of either mortality or morbidity. But certainly, I think the whole area of viruses and what damage they can do to, these are cutting edge research that's going on around the world, actually, to understand the pathophysiology of what these post-viral syndromes are. And COVID gave a boost to that kind of research. Bernhard, do you want to add something?
No, I can't really add much, but I was also just to say that I think the COVID pandemic has again brought to the forefront a lot of these questions that we simply didn't look into in the past because it was so massive in the numbers. The overall numbers were so massive. And of course, because of that, also larger numbers, absolute numbers in people who had these long-term sequelae. I think that one of the things that sort of, on a personal note, what made me very nervous is how we saw symptoms which had nothing to do with the typical respiratory symptoms, right? A cough, a sneeze, and whatever have you, pneumonia. It was the loss of taste, the loss of smell. It was the things that happened in the brain, which clearly show that there are mechanisms that go beyond damage to the respiratory tract, which make me very nervous. And I think that's where we have to look much more carefully. But that also makes it so important that we really re-emphasize on prevention, that we try to stop these viruses before they can do this damage. Also, the treatments are very important because and that's the one thing we actually also learned from AIDS, and we struggled for so long. Should we start early? Should we start late? Until we really got the science that showed that the earlier start, the better, because you protect the system, the body, from being damaged, fundamentally damaged through the virus. So don't wait too long, treat early, but for that we need to have, of course, better treatments. But that's where I think the loop closes again and is very important.
Right, are we bringing up the next question? Yeah, Arun Kumar asks, how does HMPV spread compared to other respiratory viruses like RSV or influenza? I think you had something on this, Dr. Soumya, but if you could just clarify again.
Yes, so we used to think about transmission as either droplet transmission or aerosol transmission. So droplet transmission, usually like influenza is a very typical example, and probably HMPV is the same, where when someone who's infected is speaking or coughing or sneezing, there are droplets that come out, and these droplets either fall on your hand or they fall on objects around you. So if someone comes and touches your hand or touches the objects on which these droplets have fallen, those have virus particles, and then you take them to your face, touch your mouth or nose, and that's how it goes in. The other way, of course, if you're in very close proximity to someone and they're coughing or speaking very close to you, then the droplets could go directly from one person to the other. This is how the whole concept of physical distancing came about, that you keep 6 feet distance so that the droplets, actually most of them will fall to the ground and will not be carried for 6 feet. Now, the other mode of transmission, what is called aerosol transmission, which is smaller particles that can actually be suspended in the air for longer. So even if you're not within that distance of 6 feet or whatever, you could still get infected if you're, say, in a closed space. There's someone who's infected who's also there and is breathing and is exhaling a lot of particles with viruses in them. You're breathing it in. If you breathe in enough, you may get infected. During COVID, I think there was a lot of research done by the engineers, by biomedical engineers, to study this transmission. What actually happens when someone coughs or talks or sings or laughs or whatever. And you find millions of particles come out of different sizes. Very difficult to draw a hard and fast line. This is droplet. This is aerosol. This is, we used to say, okay, above 5 microns, above 100 microns, but scientists now believe there can't be such cutoff. And so it's a continuum. So if I'm infected with a virus, I'm coughing, particles of different sizes are coming out. If some of them fall on you directly or fall on your, through your hands, you can spread it. But you could also be in a room, like an air-conditioned room, a small space where you're traveling or you're working with a few other people, and then I'm coughing there all day, filling the room with virus particles. And if you're susceptible and you're breathing that in, you can get infected. So it's the function of the load of viruses that I'm exhaling if I'm the patient who's infected, your own immunity, because if you've had a vaccine recently or you're immune, you're not going to get infected even if you breathe it in, and the ventilation of the room. So when you add up all these factors, this is why we talk about good ventilation, about taking precautions like wearing a mask, not being in crowded spaces if you have a cold and cough, and certainly not spitting around the place, or coughing out without covering your nose and mouth. So those simple precautions can reduce the spread of respiratory infections, not just viruses, but including diseases like TB.
Rider, is there a, if I may just add a rider, Dr. Bernhard, is there any sort of regulations in China that say one must be masked or take other precautions, particularly during the flu season?
Currently, there's no regulations like that. I mean, there used to be during COVID, just like in many other countries, that if you enter a crowded space, a shop or something, or go outside, you should wear a mask, simply to minimize the risk. And what we have learned, and I think Soumya has said that, is that very often wearing a mask, if you're actually infected, is the most important, because it prohibits droplets or aerosols to get out, and that's the most effective measure. But you cannot say only those with infection should wear a mask, because you don't know. So the only thing that works is if everybody wears a mask, and very consistently. Now, there is no regulations right now whatsoever, but there is, of course, encouragement, and because there's a long tradition in places like China of people having understood and follow such measures, you will see many more people actually wearing the measures, because they're wearing masks and doing hand washing or whatever you do, because they're, I should say, trained on this. They know it, and they have appreciated how that may help them. So that's something that very quickly starts whenever there is an increase in respiratory infections, but no rules that would force people to do so right now.
Right, thank you. Just waiting for the other questions to come up. The other question, this is more broad, that I wanted to ask is the whole question of comorbidities today. So we have, particularly India has burgeoning epidemic of diabetes and hypertension. Kidney disease is also adding to the mix. And we all know, at least from COVID, or even before that, but COVID sort of brought it to the forefront, that comorbidities do have an impact on how severe the illness is for you. So, of course, it may not make any difference to a cold, but is there any? Do you have a point of view on how nations handle these kind of comorbidities like maybe diabetes, hypertension, etc.? Dr. Soumya?
So I think this is actually a really very serious problem for India, but also for many other developing countries, because I think the rates of what we call non-communicable diseases are growing so fast due to many risk factors that are very common. And it's sort of a silent epidemic or a pandemic, you could say. And diabetes and hypertension predispose you to so many complications and really impact quality of life, particularly in later years. And the earlier you get diabetes or hypertension and the less well controlled it is, many people don't even know they have it. And even if they know, for one reason or another, they're not taking regular treatment, it's not under control. The complications that you get ultimately are not only a big burden for the person, their family, but also for the health system. It's very expensive. Once you get kidney disease, you need dialysis, renal transplantation. Once you get a stroke, you need, of course, your quality of life goes down. You need rehabilitation for a long time. Heart attacks, very expensive for the health system and for the person and the family. Plus, we saw during COVID, of course, that these underlying comorbidities make you more susceptible to viral infection. So if you're a healthy person and you get it, you're much more likely to recover. But if you already have diabetes and other complications, you're much more likely to get a pneumonia, end up in the hospital, and so on, because your immune system is impacted. Diabetes does impact your immune system. So this is the reason why it's really important for us when we think about a healthy society, is not to focus only on infectious diseases, but to really understand the risk factors. And prevention is much better than treatment in terms of non-communicable diseases, because there is no cure. So you've got to be on lifelong treatment. So as far as possible, if you can take steps to prevent these diseases by promoting a healthier lifestyle, and this is where the government has a responsibility, and so does the individual. It's not all up to the individual. Individual can do a lot of things like physical activity, you can regulate what you eat, etc., to a certain extent. But we also know that a healthy meal is unaffordable for many people in developing countries. The FAO has shown that only about half or less than half the world's population can actually afford to eat a nutritious diet. And so the others are doing it not by choice, because they just can't afford a healthy meal. And this is where I think government policies can make a big difference. Similarly, less sugar, less salt. This is something the industry has to be regulated. There has to be strong regulation on things like salt and sugar, and taxation, and both incentives and disincentives. So I think, and then the third is air pollution. So I think if we can deal with a healthy diet, with air pollution, and with physical activity, we go a long way. And tobacco, of course. Tobacco and alcohol are the other two major global risk factors for NCDs. These five are the ones that we really need to act on in order to prevent more people from developing NCDs. And I think China was also in that same stage, and they've done a lot on air pollution, certainly. But Bernhard, how are they dealing with NCDs?
I know you just answered this very comprehensively, beautifully, but you're right. China had a massive, massive problem with air pollution. And I recall myself the days where pollution was like 400, PMI was 400 and above. So you could hardly see, the houses on the other side of the road. So these times are very, very rare now, because the government declared a war on pollution, because they realized the health impacts that everybody has. The government, everybody has to breathe the same air. You cannot escape it. So there's a major, major push going on. Now, on the non-communicable diseases that you mentioned, Soumya, China has equally a massive problem. I think these big nations also still with large poor populations are very, very hard hit. There is data that about half of the adult Chinese population is what we call pre-diabetic, with a very high risk of developing diabetes. The high rates of overweight, especially in young people, which makes the point so important that Soumya said, the earlier you actually start, with a healthy life, it actually starts at birth. Healthy life starts at birth, and healthy aging starts at birth, which we should never forget. That's so incredibly important. And that's, again, also Soumya mentioned this, what we saw in COVID. It was the people with underlying conditions who died. It was the old people who died, because their immune systems is less prone to cope with these challenges. And that's something that's very important. Now, I want to highlight one point that also Soumya said a little bit in passing, and that's the role of the private sector. I think especially, as Soumya mentioned, the availability of healthy food is just incredibly important at affordable prices. What we see is that the massive increase in sort of prepared food, fast food, the sugary drinks, which caused massive, massive pandemics of obesity in many countries, diabetes. And these are all things, some countries have been able to cope with it, but the massive resistance of the very, very powerful agriculture sector, because there's so much money involved in the food sector, there's so much money involved. The very active resistance to actually shift gears and make healthy food what you should earn the money with, rather than the cheap stuff, if I may say so. And I think that's entirely possible to do that. It's not that we're asking to cut their revenues. We are asking, make your revenues with healthier choices and support people with healthier choices. And that's something where I think that mankind has to learn. And I would like to push a little bit. So One Health approach is, of course, critical. And Soumya has given many, many examples. But the way we have looked at the One Health approach in the past is that we are talking sort of about the other thing. We never put ourselves, the humans, in the center. Global warming, we have talked in my youth, we have talked about the icebergs in the Arctic, in the ice, but we have never talked about people dying. And I think unless we fundamentally shift it and say we have to fundamentally put people, we have to fundamentally put life at the center, because this is what it's all about, and also put our actions at the center. And that's the governments, but that's the individuals. It's all of us together, because there's a huge risk that everything will get completely out of shape, and that the global warming will create situations that just makes the earth not as a habitable place anymore. So there's really, really an urgent need for coming together in a different way, rethinking also development markers. I mean, when I get into discussions, usually what is said, we need to look at GDP. GDP is the most important. That means the economic development is the most important indicator. And I would like to challenge that. The one thing that we have learned is that unless we are healthy, unless we are strong, all the money doesn't help you. So what we need to move towards is actually a healthy economy, rather an economy that may support also health, because there's more money. So it's a rethinking that we need to engage, because there's really health and life at stake.
Since we've had discussions on diet, on a healthy diet. I'm going to take this question from Ravi Kumar. He says, is it right to go vegetarian? Dr. Soumya.
There's a big movement, globally to go vegetarian. And the reason is that when you eat animal protein, meat, you are actually using many more natural resources, because obviously you're using more the water that is then used to grow plants. The plants are then used to feed the animal, and then the animal is then eaten. So if you really look at the carbon footprint, a non-vegetarian diet has a larger carbon footprint than a vegetarian diet. There are parts of the world where definitely meat consumption should be reduced because of many reasons. One is people's health. It's not good to eat a lot of meat, particularly the processed and ultra-processed meat that many Western countries now they're eating. And also the way that the animals are being now farmed, that I talked about, these industrial farming, that's very bad for the environment. And it's also cruel to the animals. But I must say that protein is important, that for good nutrition, and animal protein is very high quality protein, and that's why we encourage the provision of eggs, for example, in the school meals, the midday meals, the Anganwadi meals, because it's very important, especially for growing child, but also later in adulthood and aging, to have enough protein. So in large parts of the world, actually, people are not getting enough protein, and therefore we should not be telling everyone, you have to become vegetarian. Firstly, it's a choice, of course, whether you want to be vegetarian or not. So it should be an individual choice. But if you are, then you must have adequate sources of protein coming to you from vegetarian sources. And that's what is actually not happening. So today we are faced with a situation in India where we have calories enough, everyone's getting enough calories. The government has a large PDS program. So there's no shortage of calories, but there is a shortage of protein and micronutrients, vitamins, minerals, that you can only get from a diet that is balanced, nutritious, has fruits, vegetables, nuts, milk, eggs, etc. So I think to answer the question, it's a choice, but you can have a healthy vegetarian diet, you can also have a healthy non-vegetarian diet, but there is a movement globally, of course, that we should reduce the carbon footprint of people, because there's overconsumption of meat in many parts of the world.
Right. I'm going to take a very interesting question by Yashish Bharadwaj. He says, what makes HMPV different from COVID-19, as both are contagious, but one turns to a pandemic and the other doesn't?
Very simple answer is that we've been exposed to HMPV for a long time. It's not a new virus, and therefore we have immunity. Most children are exposed to it. It's part of the common respiratory infections that children get. And as Bernhard was saying, we don't all test ourselves every time we have a cold. So we don't know what exact virus it is. And today it could be SARS-CoV-2. That's also become a common respiratory virus now. And so people are doing surveillance. We know you have influenza A and B, you have respiratory syncytial virus, you have SARS-CoV-2, you have HMPV, and then you have a host of others. So this is the big difference. Once you get used to a virus, the human race develops immunity, and then you don't get the kind of severe impact that a new virus had, like SARS-CoV-2 had.
Right. I think this is a question by Ranganath Ramadas on the origin of epidemics. Why are there so many epidemics that originate in China, Asia, Africa? Is there an answer to this, Dr. Bernhard?
Well, there's many things that we actually don't know about the origins of some of these pathogens. And the Spanish flu actually started in the United States of America, even though it's called the Spanish flu, because I think that's where it was then mostly observed. And that's the same for some other sort of, at least large epidemics, not to say a pandemic, which by definition sort of includes all parts of the world. So that's one thing. The other thing is that, of course, lifestyles where people, and Soumya has alluded to that. I think that the critical part of the intersection of wild animals, which usually or in the past lived in their habitats where the chance of meeting a human was actually very slim due to many factors. Some of them are man-made. So we're actually holding and trading these animals, which are wild animals. They're caught and they're brought to a market where they can be exposed to many, many, many humans at the same time. These are things that should not happen. And I think increasingly the regulations of countries try to avoid that. But equally, through the destruction of the natural habitats, through the increasing temperatures, these animals migrate to other places, including those where more people live. Those are things which are sort of promoting, of course, the occurrence of the jump that a new virus actually becomes, which actually we should be careful the way we describe it. These are not really new viruses. These are viruses which are previously unknown in mankind, right? In humans. There's a jump which can be facilitated either through what I just explained, sort of the closer living environments and interactions between the species, but also, of course, through mutations that happen on a regular basis, and some of that happens just by chance. And so that the virus of an animal that's sort of well known in animals then is suddenly more easily to be transmitted or infecting humans. Now, these situations do occur, of course, in places where they're very populous. China is such a place, or where people are living very closely with animals, and that's very often happens in Africa or in the Middle East, where we saw this, the MERS with the camels. But there's no way that we could rely on that. I mean, that can happen anywhere. And I think that's where we globally need to be just so alert and work together across borders to make sure that whenever something like that happens, we recognize it early and design the right countermeasures together.
Right. Do you want to add to that, Dr. Soumya, or should we move on?
No, I don't have anything to add.
Right. So I'm going to. We've had, we have about 4 minutes, less than 4 minutes to go, and I'm going to take the last question, which is from Naman Nair. He says, "Is there any possibility of a lockout if it spreads wide?" I'm going to expand it, sort of extrapolate it to other respiratory infections that might arise in the future. Is a lockdown, a possibility in the future if we were to have similar epidemics? Is this like an extreme measure?
So maybe I can go very quickly. A lockdown is a very extreme measure, and it was taken because there was no other known countermeasures at that time, and one had to stop the spread, try to stop the spread of this infection, which was clearly taking a toll on people, and therefore when you don't have anything else, you go for a lockdown. But I think we've learned a lot from COVID, where lockdowns work, where they don't work, where they actually may cause more harm than good. And particularly, we saw that in developing countries where people really depend on their day-to-day work, then things may actually become really bad, if you have that kind of a lockdown. And we saw the impact on economies as well. I don't think anyone would want to repeat that kind of thing. So I think the important thing is really to go very scientifically as to what measures have the most impact with the least amount of adverse, sort of unwanted effects, and for what type of virus and at what stage of the disease. And so one of the things is that the sooner you can develop these tests and drugs and vaccines, the less the period you're going to need these very drastic kind of measures. And we said in the case of COVID, it took a year to develop vaccines, which in itself was a record. The hope is that the world can do even better next time and maybe do it in 3 months or 6 months. So that would help. And the other thing, of course, is to take measured steps where you want to maximize the benefits, protect those who are most vulnerable. So the moment you know about a virus, this virus is most dangerous in young children, and you really want to protect that group. Or this virus is more dangerous for older people, then what steps can you take, to protect that group. And of course, healthcare workers and frontline workers are always at risk, and so they need to be protected. So I think those are the kind of steps that the governments need to ensure beforehand. And that's what we call when we say building resilience into the health system, so that when you're faced with a shock, you don't completely collapse, but you're able to deal with the shock and at the same time keep your other health services running, which again was, we saw during COVID the massive impact on immunization services, TB, maternal health, everything else was impacted because healthcare facilities were full of COVID. So that's what building resilience is about, and that hopefully countries are working towards.
Thank you. Dr. Bernhard, would you like to add a few concluding remarks and then we can wind up?
Just one point that I think it also has shown how important it is to have equitable access to the countermeasures like vaccines and drugs. The one thing we have learned when it comes to pathogens that have a pandemic potential, because they're new entering into human mankind, as Soumya explained, not the ones that we have been dealing with and we could gradually build a population immunity. We have to make sure that everybody in the world is actually as quickly as possible protected to the extent possible, because it always comes back. That's the one lesson, and we've struggled with, and still struggling with, what's under this discussions of the pandemic treaty, that the world is not really coming together yet to recognize these challenges. And we have seen how the virus and different strains have actually moved, from one place, and then it came back, maybe slightly in a slightly different form. So unless we really look at this in a global scale, then we will not be able to win.
Right. Thank you so much. Thank you so much, Dr. Soumya and Dr. Bernhard, for this, for spending an hour with us today. We've had a lot of lovely questions, interesting questions, but because of time constraints, we're not able to take some of them. Some of them have already been answered by our experts in answers. So thank you all for coming. Thank you once again to our panelists. We're so grateful that you made time to be here today. Thank you, Shika, for all the support. Thank you and have a good bye.
Thank you and bye-bye.
Thank you very much. Goodbye.
Bye.